In modern medicine, key breakthroughs are born where different cultures, scientific schools, and technological approaches come together. In the autumn of 2025, Professor, Doctor of Medical Sciences, and leading Russian pain management specialist Evgeny Leonidovich Sokov from the Pain Management Clinic of the Vinogradov University Clinical Center, a branch of the People's Friendship University of Russia, visited the People's Republic of China, one of the most rapidly developing medical ecosystems in the world. The purpose of the visit was to participate in an international conference on innovative technologies in medicine and to develop scientific cooperation in the field of pain management. At the conference, Professor Sokov presented a Russian innovative technology, intraosseous therapy. This is a unique interventional method that utilizes the anatomical potential of bone structures as a direct pathway to influence the mechanisms of chronic pain. This approach allows work at a level inaccessible to traditional pharmacological strategies and opens up new possibilities for restoring disrupted neurophysiological processes. The presentation generated significant interest among specialists from leading clinics in China, Europe, and South America.
After I gave my presentation on intraosseous therapy at the international conference in China, I was asked a great many questions about this new medical technology. Our Chinese colleagues expressed great interest in mastering this technique and spreading it throughout the People's Republic of China. We also outlined plans for joint scientific and technical cooperation, and later Professor Gao from Brazil joined us, who also showed great interest in introducing intraosseous therapy in Brazil. As a result, an international collaboration has essentially formed around the implementation of this new medical technology.
The visit program included trips to several medical centers in China and familiarization with their healthcare organization system. Particular attention was drawn to the model of integrating modern and traditional medicine. One of the key points was a visit to the large multidisciplinary center, Run Shaw Hospital in Guangzhou, where the work of interventional medicine and modern organizational approaches were presented.
I attended various interventional pain treatment procedures which were performed to the highest standard under 3D CT navigation. I would like to note that the pain management clinic in this hospital is organised to the highest standard, separate wards, outpatient consultations, and a great deal of very modern equipment for pain treatment, which is actually used for treating patients. Pain medicine, or algology, is essentially an independent field and is separate from anesthesiology. This is a very important point.
The Chinese side showed a deep interest in the Russian method of intraosseous therapy. After a series of discussions and scientific meetings, the management of Run Shaw Hospital confirmed their intention to introduce this method into the clinical practice of the holding and to participate in the joint research program.
Together with our Chinese colleagues, we discussed the possibilities for joint cooperation and for training Chinese specialists at our pain treatment clinic at RUDN. And they are ready to come to us in the near future for this training. And the leading pain specialist, Professor He, is planning to visit us in December to familiarise himself with this method and to take part in our conference on the 20th of December this year.
The visit to China demonstrated the great potential for international cooperation and the strong interest of foreign colleagues in Russian developments in the field of pain medicine. The connections established, the agreements reached, and the open professional dialogue had become the foundation for new ideas and projects that could significantly influence the development of interventional medicine in various countries around the world.
I believe that participating in this conference will lay the foundation for international scientific and technical cooperation, both with the People's Republic of China and with other countries.